Hi everyone, it's Beatrice, and my topic is the use of psychosocial evaluation in cosmetic surgery. I hope you enjoy. While the terms plastic and cosmetic surgery are often interchanged, they're actually quite different. Plastic surgery focuses on reconstruction, while cosmetic surgery enhances already functioning features with the goal of improving appearance, symmetry, and/or proportions. The top 5 cosmetic surgical procedures include breast augmentation, liposuction, eyelid surgery, nose reshaping, and facelift. And then we have the top 5 cosmetic minimally invasive procedures, which include Botox, soft tissue fillers, chemical peel, laser hair removal, and intense pulsed light, which helps improve skin tone. The cosmetic surgery industry is growing rapidly in the United States. In 2019, there were 18.1 million cosmetic procedures performed and $16.1 billion spent. These procedures range in price, and the national average lowest being $1,296, which was for dermabrasion, to $8,073 for a lower body lift. With the increased amount of procedures, there's an increased opportunity for malpractice. Controversy arises when autonomy and non-maleficence conflict. It can be argued that the surgeon's only job is to perform the procedure because cosmetic surgery is elective and private practice. But on the other hand, there is potential for both psychological and physical harm. It is the cosmetic surgeon's duty to conduct a psychosocial evaluation to ensure the non-maleficence of the patient and fulfill the obligation of an all-encompassing healer. The ethical conflict are autonomy and non-maleficence. Autonomy is the driving force for cosmetic procedures because it is elective. These procedures are not necessary to an individual's physical well-being. The features operated on are already working. Informed consent upholds the principle of autonomy. While an individual may think true autonomy is the right to make a choice and have the provider abide by it, it's about having all information necessary in order to come to a reasonable consensus. Non-maleficence is the action of not inflicting harm onto the patient. Operating on vulnerable populations is negligent. With the prevalence of body dysmorphic disorder at 7 to 15% in cosmetic surgery patients, depression at 50%, and anxiety at 32%, there's a higher incidence of mental disorders in patients who pursue cosmetic surgery than in the general population. With no physical benefit to cosmetic surgery, the risks of hematoma, infection, blood loss, and deep vein thrombosis put the client at unnecessary risk. There is a discrepancy in the percentage of patients with body dysmorphic disorder in cosmetic surgery versus the general population, which is about 1 to 2%, and in both of these cases, it is underdiagnosed. And yet, surgeons performing these procedures are well aware. 84% of surgeons reported having operated on patients with body dysmorphic disorder. This proves to be an issue when even after an intense procedure and recovery, the patient remains dissatisfied, oftentimes more so than before the procedure. The incongruence between expectation and reality for the patient further perpetuates these thoughts and behaviors. On top of the psychological harm, the patient is likely to resent their surgeon, damaging that individual's trust with the overall healthcare system. The Code of Ethics mentions utility, justice, autonomy, and non-maleficence. The overall tone of this code of ethics speaks with greater defense and protection for the providers rather than the patients. In regards to utility, the cost of any given cosmetic procedure may be set by the surgeon based off time, labor, and skill. We've seen the tremendous cost of these procedures. This is not a luxury affordable or accessible to all. As mentioned several times, the elective nature of cosmetic surgery allows for surgeons to choose whom they serve. Informed consent is discussed with the expectations. The provider includes a thorough explanation of the procedure, indications, benefits, consequences, probability of risks, alternatives, and expected outcome. Harm must be calculated, and the surgery must be deemed as justified by the provider. This code of ethics lacks a sense of accountability for the provider and fails to mention the priority of the patient's overall well-being, which is reflected. In our clinical ethics textbook, it states that physicians have no obligation to perform surgery if it is medically unnecessary. Moving forward with intentionality and initiative is a step in the right direction. The disposition of cosmetic surgery urgently needs to shift to benefit the patient long term. Informed consent is crucial to the tone of cosmetic surgery. During the consultation, expectations should be discussed in order to determine feasibility. The Body Dysmorphic Disease Dermatology version is a high sensitivity questionnaire the client is able to quickly complete in order to make the provider aware of the possibility of body dysmorphic disorder in the patient. Screening such as this one allows for harm to be prevented and referrals to be made. These type of questionnaires, however, are not to replace a face-to-face conversation in which the provider is able to pick up on an individual's social cues and potential hazards or warning signs. This well-rounded implementation of psychosocial screenings and genuine conversations builds the reliability of the profession and, most importantly, prevents the patients from harm. The picture on the left is part of the Body Dysmorphic Disease Dermatology version screening tool. As you can see, there are questions that require reflection and questions with numerical value. The questions are straightforward and approaches the topic from different angles. The provider can look over this and engage in further conversation with the patient. Thank you so much for your time and patience. I hope you learned something from this presentation, and at this point, I'd love to answer any questions if you had any. If you're interested in learning further about this subject, I listed my references so you can go back and read these.